Good day and welcome to my channel. Today I'd like to discuss a condition that is silent but deadly. This condition is called atrial fibrillation or A-fib. What is atrial fibrillation, you may ask? Atrial fibrillation is a condition of irregular heart rhythm, highly prevalent. A lot of people over the age of 50 will have it without knowing that they have it. And what is the consequence? Atrial fibrillation can last for a long time once it starts, and then can cause sudden stroke without an individual even knowing that they had it. So let me show you what atrial fibrillation is. Imagine that this is your normal heart contracting like this. You can see that. In atrial fibrillation, the heart is going like this, no rhythm, normal heart, atrial fibrillation all over the place. Sometimes atrial fibrillation can be very chaotic and so fast that some individual may experience symptoms. Sometimes it may even be very slow, that the individual may also experience dizziness or shortness of breath. Now, how common, you may ask, is atrial fibrillation? Well, imagine that as you age, the frequency increases. For men and women over the age of 55, about 10% of them, or 1 in 10 of them, will have atrial fibrillation. As you get into your 60s, 1 in about 8 people will have atrial fibrillation. By the time you're in your 70s, it's probably about 1 in 5. By the time you're in your 80s, 1 out of every 3 men or women will have atrial fibrillation. Atrial fibrillation may come and go, or atrial fibrillation may be persistent, be there all the time. Regardless, whether it's there persistently or it comes and goes, what we call paroxysmal atrial fibrillation or intermittent atrial fibrillation, the consequence is the same. You may experience sudden stroke. Under normal circumstances, you may ask, what are the symptoms of atrial fibrillation? Most of the time, people who have atrial fibrillation do not have any symptoms. They go about their life, their business, enjoying life, until suddenly they experience stroke. They show up to hospitals and we put them on an EKG monitor, perform a 12-lead EKG, and we find out they have atrial fibrillation. That's how a lot of people are diagnosed. Other symptoms that they may have is, if the rate is too fast, the individual may experience chest pain, shortness of breath, or dizziness. Some may also experience just plain out, passing out, or intermittent, occasional weakness or numbness on one side of their body. So, how do we diagnose it? Short of the person having a stroke, the usual diagnosis is to go to your doctor at least once every 2 years, have the doctor perform a 12-lead EKG, electrocardiogram. The electrocardiogram may show that your heart is in normal sinus rhythm, or it may show atrial fibrillation or some other abnormalities. But even if your heart says normal sinus rhythm, which is normal rhythm, that does not mean that you don't have atrial fibrillation, because some people will have it off and on intermittently. So, if you are experiencing occasional sudden numbness or weakness on one side of your body, occasional difficulty with your words, occasional visual changes, or any other thing such as intermittent dizziness or chest pain that is not due to coronary artery disease, your doctor may have to order something called cardiac monitor. There are some cardiac monitors for 14 days, some for 30 days. The longer you wear the cardiac monitor, the more likely we are able to diagnose your atrial fibrillation. And once atrial fibrillation is diagnosed, there are so many types of treatment we can give. We can give treatment to slow down the rate, and then we'll determine whether you meet the criteria to be placed on blood thinner called anticoagulation. If you do, we order that and we explain the risks and benefits. Some people may need electrical intervention called cardioversion or ablation. Others may have to wear something called Watchman device or undergo Watchman procedure for the atrial fibrillation. What are other complications of atrial fibrillation? These include congestive heart failure, sudden gangrene of your intestine, loss of kidney function suddenly, or even gangrene of your leg, or passing out, syncope. All of these are serious complications, but the most deadly, devastating of those is stroke. And so, please pay attention to your body, watch out, be diagnosed, and be treated so that you don't become a victim of this treatable or manageable condition. Please subscribe to my channel, give us a thumbs up, and watch out for my other videos. Thank you. Until next time.